I'm Dan Lasserson. I'm the lead of the out-of-hospital care network in the Oxford AHSN. The focus of the out-of-hospital care network is the older patient who lives with frailty, who's become acutely unwell and is in their own home or in a care home or other sort of environment. And we are focused on understanding how we can change the processes of care, both for health and social care, that people in that situation receive. We want to understand how we can deliver an experience of illness and recovery that's very different, it's better, and we can use a lot more technology to understand what's wrong with patients and how best to treat them much earlier than we do at the moment, and with the potential to increase the number of patients that we treat without using a hospital bed when they're acutely ill. So patients are a really important partner for us in the out-of-hospital care network. We want to give their care their way. We need to understand more closely, I think, how patients want to be treated in the future. So, for example, we recently had a stand at the BRC Open Day, that's the Biomedical Research Centre in Oxford, and we asked all the patients and the public who came in how they wanted to be treated. A lot of patients wanted to be treated nearer their own home, as close to their own home as possible. They wanted better access to the tests that were going to help make them better, or to help the doctors understand what was wrong with them, and to have quite a different model of care that they still wanted the right expertise, but not necessarily to need to be in a hospital bed to access that expertise and treatment. A good example of how we can change the process of care for acutely ill patients who live with frailty is the Emergency Multidisciplinary Unit, or EMU, that's based down at Abingdon Hospital. And this was set up about 4 years ago so that we could implement a very different model of care and allow us to diagnose and treat patients closer to their own home without needing a hospital bed. We still rely on the expertise of the medical teams in hospitals who would be working differently, but we would be using a lot of technology that's what's called point-of-care diagnostic technology. And this is where blood tests that traditionally will take several hours in the laboratory for results to become available will be available within minutes of a patient arriving on our unit. And that means that doctors can understand what's wrong or understand what the impact on a patient's body is of a certain illness without needing to be in the hospital environment. So it allows for much sort of safer decision making and care outside of hospital, i.e. close to where patients live. So patients would be getting, if you like, the medical ward round that would happen in the hospital, and the nursing care and the access to the therapists such as occupational therapy or physiotherapy, as well as seeing a social worker, but they can stay in their own beds in the evening in a much more comfortable environment, and that reduces some of the trauma around hospitalisation in our kind of frail and older patients. So in 5 years, I hope that the network will have achieved a very different experience for patients, an experience of illness and recovery that's different and better for them. I hope that the partnerships that we form amongst the innovators in clinical practice and in organisation of care will have resulted in much more rapid learning of what works and what doesn't when we change processes of care, and how best to use advances in technology, particularly point-of-care diagnostic technology, in how we can deliver an answer about what's wrong with somebody much more quickly than we do at the moment, and that will enable us to deliver care differently, more rapidly, and out of hospital as well. And we also have new research being undertaken by new academic partners that addresses the question of how we can both deliver health and social care together to patients who have both mental and physical illness and who are living with considerable frailty.